Today, we're going to do a basic overview of the Hamilton G5 ventilator. This ventilator can provide modes of ventilation for 3 different patient populations: adult, pediatric, and neonatal. We can also select the gender of the patient and dial in their height. This provides for more accurate readings for our modes of ventilation specifically for each patient. To start, let's talk about the main display. What we set for our patient and the mode of ventilation is all going to be found on the right-hand side of the screen. You'll notice in the upper right-hand corner, the active mode is found in the upper right-hand corner. This mode is APV-CMV for this example. APV-CMV is the same as PRVC and the servo I. To help with the mode verbiage, we will have laminated sheets with the different types of modes and what their equivalent is for different types of ventilators, just to help with the transition. We will set our rate, tidal volume, PEEP, and FiO2 all on the right-hand side. We can also dial in and adjust our alarms on the right-hand side of the screen as well. On the left-hand side is real-time readings of what the patient is currently doing. You will see the peak inspiratory pressure, the mean airway pressure, tidal volume, minute ventilation, and rate. You will also see a lung icon on the main screen. The lung icon just provides a visual aid of what the lungs are doing for the patient. The sharper the angles are, the more resistance the patient is experiencing and the less compliance the lungs are. If you see that the white lines become more rounded, that means that they have increased compliance and they're easily ventilating. This just provides a visual aid to help us set better modes for those patients. You will also see in the bottom right-hand corner different parameters and alarm settings with silver discs. This is just another visual cue to help us be able to wean the patient off the ventilator quicker. When the silver discs get down into the white zone, they are in acceptable ranges to place them in a spontaneous breathing trial. On the bottom part of the screen, there are 5 main soft keys. The first key is your alarm silence. If the vent is alarming, you may press the alarm silence. It will light up in red, and you'll have a 2-minute countdown in the upper left-hand corner. If the patient is desatting and you need to give them increased oxygen, you may hit the O2 button with the arrow. It will light up in green when the patient is getting 100% FiO2. You will also look at the FiO2 and see that it's lit up in green and it has a 2-minute countdown. To cancel the increased FiO2, you may simply hit the O2 with the up arrow again and deselect that option. You'll also see another button that is a lung. That is to simply provide extra breaths to the patient. It is like begging the patient without ever having to take them off the ventilator. Each time you press the button, you will deliver a breath to the patient. The nebulizer with the on-off provides us the feature of delivering nebs through the ventilator. We can do that with the Aerogen AeroNeb or a standard nebulizer. And last but not least, the standby button. If we need to take the patient off the ventilator, we may place the vent on standby. This simply keeps our vent settings, but places the vent in a suspension mode. Press the power button and then activate standby to stop ventilation. You will see that a timer pops up and that will tell us how long that the ventilator's been on standby. To place the patient back in a ventilation mode, you're simply going to hit the power button again. The way that the vent measures the peak inspiratory pressure and tidal volume is a little different than any other ventilators. You'll see that it has a flow sensor line in line from the circuit to the patient. This provides more accurate readings as it's measuring directly at the patient. To provide the best readings, you want to make sure that the clear and blue lines are pointing upwards towards the ceiling. If it is not and condensation occurs, it will travel back to the ventilator and give false alarms. Speaking of alarms, you will see that in the upper left-hand corner of the screen, you will get two different types of alarms. A high priority alarm will show up in red, and it will have 5 beeps and a red flashing bar. This is your cue to clue in on the ventilator, as it is something that needs to be addressed right away. A moderate to medium alarm will show up in yellow, and it will flash in yellow and then become solid. That is just a cautionary alarm of saying, hey, look at me, something's not right. Again, a high priority alarm is going to be a flashing red icon on the top and a red alarm in the upper left-hand corner. If by chance the ventilator goes off and you're not for certain of what it was and you call respiratory, we can look into events and select alarms, and it will tell us everything that the vent alarmed about, and we can adjust our settings appropriately. We can also see when vent settings were changed and what time they were changed. If you have any other questions about the Hamilton G5, please don't hesitate to ask respiratory. We're happy to help.